is Andrea, and I'm here to talk about Chapter 12 for HIT 210. We have lots to cover. I'm going to try and do this in 15-minute segments so it's not too onerous to get through. I'll also probably be bringing in some other things to show you. This is my first time using Screencast-O-Matic as a way of recording my videos, so please be merciful if we run into some technical glitches. I will do my very best, but no promises of perfection, I'm afraid. So, what are we going to talk about? These are my teaching notes, and I'm just sharing them with you so that this is you can see and understand as I go through them. That's really what this is about. Okay, so what are we going to talk about for Chapter 12? We're going to talk about coding classification systems, sequencing of codes, ICD-10-CM code format, ICD-10-CM organization, coding ethically, basic coding guidelines, and then you'll note at the bottom here I have the ICD-10-CM online code book. This is the CDC link I was talking to you about the other day that's really easy to use and that I'll show you how to use as we go along. And the address for that is https:// ICD-10CM tool.cdc.gov /FY equals FY2020. And that's for fiscal year 2020, which you'll see as we go into that screen. So this is just to cover content so you know what we're going to be talking about in this series of videos. Coding classification systems. There's really 3 coding classification systems that you need to know about. And these are nationwide, here in the United States, what is used. ICD-10-CM, which is what Chapter 12 in your book is all about, is diagnoses. This is used for inpatient, outpatient, skilled nursing homes, home health, hospice, physician offices. Everybody uses ICD-10-CM for diagnoses. Now the middle one is ICD-10-PCS, and that is only used in hospitals for inpatient procedures. So we are not going to go over ICD-10-PCS because it's not something you really need to know, but also it's complicated, complex, challenging at times. But many of you will probably not end up in an inpatient facility helping with inpatient procedural coding. So I'm not going to cover that. The last one on the screen is CPT-4, and that is used to code all other procedures except for hospital inpatient procedures. So the first one, ICD-10-CM, all diagnoses, is Chapter 12, and that's what we will be covering the next couple of weeks. Then we move on to Chapter 13, and that's the CPT-4, learning about all outpatient procedural coding, whether that's an office, a nursing home, hospice, those types of things. It's also facility billing versus professional billing for the provider who's providing the service, excuse me. So the first and the last are the 2 we're going to focus on, the first being ICD-10-CM for Chapter 12, and then in a few weeks we'll switch to Chapter 13, which is CPT-4. So that's what we'll be doing. Okay, so from here on out, we are only talking, just keep in mind, ICD-10-CM diagnoses. That's all we're talking about. We're not talking about the other 2 coding classification systems, just the diagnosis one, just ICD-10-CM. All right, so if by chance you happen to be in the inpatient setting and you're wondering about sequencing of codes, I'm just going to cover this very briefly because odds are you will not be in this setting, but I wanted you to at least know the principles behind it. You have what's called your principal diagnosis. What is the underlying cause of need for hospitalization? The way I like to think about it is what bought the bed? Why was the patient sick enough and needed such intensity of service that they had to be hospitalized? What bought the bed? Which one of their conditions was so acute at admission that they were admitted. Now, you will have secondary diagnoses. These are called complications and comorbidities, or CCs, or major complications and comorbidities, MCCs. These are other conditions that are diagnosed and or treated while the patient is hospitalized, and they reflect the intensity of service provided to the patient as well as the severity of the patient's illness. When you're in the inpatient setting, you can code possible, probable, suspected, likely, if that's the way the provider documents it. So now we've just been talking about inpatient. So that whole left side of the screen, that is inpatient only. Now we're going to shift to all other settings on the right-hand side of your screen. All other settings, that means all outpatient settings, all nursing home settings, hospice, home health, DME, physician practices, clinics, ambulatory surgery centers, dialysis centers, anything else is this all other settings on the right-hand side. They do not use principal diagnosis. Instead, they use primary diagnosis, and that's typically the patient's chief complaint. Why am I here today? The patient asks themselves, why am I here today? This is often going to be a sign, symptom, or test result, although you hope to get a diagnosis because that is ideal. But let's say a patient comes in and they say, I have a headache. That is their chief complaint. That's their primary diagnosis. That's why they're here today. They may also be here to get a rash checked on that they were here for 2 weeks ago, or they may be here to just double check their diabetes medication and have their blood sugar checked, that sort of thing. Anything other than that chief complaint is a secondary diagnosis. These are other problems the patient seeks or receives evaluation, management, or treatment of during this visit. And you never, ever code possible, probable, suspected, likely. So if the doctor says likely hyperglycemia, you can't code it. If the doctor says high blood sugar today, you can code that, but you can't do possible, probable, suspected, or likely on the anywhere except inpatient. So since we're talking about outpatient, you can't do it. So from here on out, when we're talking about coding, you're going to be talking about primary diagnosis, their chief complaint, why is the patient here today? If you think back to our announcements, I have a slide on there that says signs, symptoms, or test results are not diagnoses. And it explains how you can use signs, symptoms, and test results to build diagnoses, but they're not in and of themselves diagnoses. But they can be coded using ICD-10-CM diagnosis codes. So I know that's a little bit crazy, but we'll go through that. What does the format look like for these codes? ICD-10-CM can have anywhere from 3 digits, or 3 characters, I should say, 3 characters, to 7 characters. The first character of every ICD-10 code is a letter, and it can be any letter except U. The second character of an ICD-10-CM code is going to be numeric, 0 through 9. Then from 3 through 7, it can be, it's usually the third one is also numeric. Usually the third character is also numeric. But once you hit the 4th, 5th, 6th, 7th, it could be alpha, it could be numeric. The 7th letter, or the 7th character, is almost always going to be a letter, usually A, D, or S. But 7 characters are not, those codes are specific, and we'll go through those. But mostly what you're going to be dealing with is 3 characters to 5 or 6 characters. That's going to be consistent. So on this diagram, you're seeing what I was describing in terms of the code format. You're seeing that the first 3 character spaces are usually category. Then there's a period. Make sure you have your period there. You can't leave that out. And it's always after the first 3. It's never anywhere else. It's always after the first three. If there are any characters after three. If there's no characters after three, you don't have to use a period. But if there are characters after three, you have to use that period. So it's character one, which is alpha, character 2 and 3, which are usually numeric, the period, and then character 4, 5, and 6 are category and atomic site or severity, and those can be numeric or alpha. And then the seventh character at the very end is usually an extension, and that's usually going to be alphabetic, and it's going to, odds are, be A, D, or S. And we'll get into that later. Sometimes, though, it can be something other than a letter, but just in general. And then on the right-hand side of your screen, this gives you an example of a code and explains kind of how it was built. So you have that. Well, let's talk organization. When you're talking ICD-10-CM, whether you're talking about a book or you're talking about the electronic online access, there are two parts to it. There's an index at the very beginning, and then there's a tabular section, which is most of the rest of the book that gives you a lot of the detail. The index is where you always start from. You always go to the index to start looking there. However, if you need one of the tables, and there are 4 major tables, 3 to 4 major tables: neoplasms, drugs or chemicals, or an external cause. If you need one of those tables, you go there first. Okay? So if you don't need a neoplasm, a drug or a chemical, or an external cause, then you're going to go straight to the index, and you're going to look up the main term to find the category, or those first 3 digits. So you're going to look under main term. Once you find the main term, you're going to look for a subterm with more information. You might get up to the next 3 digits, or perhaps an additional code, or get redirected elsewhere. And then you'll go to the tabular. Please don't code from the index. The reason is that there's often other pieces of information that you will need in the tabular to get to the right code. And if you code from the index, more often than not, you're going to make a mistake and not have the right code. So again, you always want to start in the index unless you need one of the tables. If you need the table, you go to the table. Otherwise, you look up the main term in the index to find the category. And then you can go down if it gives you some subterms to find more information. But then once you think you found the code or a similar code, you have to go to the tabular to really make sure you have your final code digits correct. So just wanted to make sure that you're aware of that. I'm going to stop the video here. It's 13 minutes, a little over 13 minutes. And because I'm going to go ahead and change my screens and bring up the CDC online electronic code book and actually walk you through using the index, and then talk about the tabular and walk you through the tabular. So I'm going to stop here for a minute and pause it, and then we'll go on from here.